There's a question that many older men whisper about in doctors' offices, search for in private browsing modes, and wonder about as they age. It's a topic shrouded in shame, outdated beliefs, and cultural taboos. The question is simple but loaded. Is masturbation healthy for men in their golden years? The myths surrounding this topic are everywhere. You've probably heard them. That sexual activity becomes inappropriate past a certain age, that it's somehow harmful to aging bodies, or that it's just something men should grow out of. Some even believe it could worsen age-related prostate issues or heart problems. But here's the thing. What if everything you've been told about sexuality and aging is completely wrong? What if the science reveals something so surprising that it fundamentally changes how we think about healthy aging for men? Today, I'm going to share with you what decades of urological research actually shows. And I promise you, the truth is not only shocking, it's liberating. Stick with me, because this information could literally change your life. The reality of aging and male sexuality. Let's start with some uncomfortable truths. As men age, their bodies change. Testosterone levels gradually decline, typically by about 1% per year after age 30. This isn't just about libido. Lower testosterone affects muscle mass, bone density, energy levels, and yes, sexual function. Many men experience what we call age-related erectile changes. This doesn't mean complete dysfunction. It means things work differently. Erections might take longer to achieve, might not be as firm, and recovery time between sexual activities increases. This is completely normal. But here's where it gets interesting. Despite these changes, research shows that sexual desire and the capacity for sexual pleasure don't simply disappear with age. In fact, many men maintain healthy sexual lives well into their 80s and beyond. The key is understanding what healthy looks like at different life stages. The cardiovascular connection, your heart and your health. Now, let's talk about one of the biggest myths, that sexual activity, including masturbation, is dangerous for older men's hearts. This fear stems from occasional news reports about heart attacks during sexual activity. But what does the science actually say? The American Heart Association has been crystal clear on this. For most men, sexual activity is no more strenuous than climbing 2 flights of stairs or taking a brisk walk. The actual risk of having a heart attack during sexual activity is incredibly small, about 2 to 3 chances in a million for a healthy man. But here's the shocking part. Regular sexual activity, including masturbation, might actually be good for your cardiovascular health. Studies show that men who have regular orgasms have lower blood pressure, reduced stress hormones, and better overall heart health markers. A landmark study published in the American Journal of Cardiology followed over 1,000 men for 16 years. The results were astounding. Men who had sex less than once a month had a 45% higher risk of cardiovascular disease compared to men who had sex twice a week or more. The prostate protection secret. Remember that Harvard study I mentioned earlier about prostate cancer? Well, the benefits don't stop at cancer prevention. Regular ejaculation appears to support overall prostate health throughout a man's life. And this becomes even more crucial as men age. Here's why this matters so much for older men. As we age, the prostate naturally enlarges, a condition called benign prostatic hyperplasia, or BPH. This can cause those frustrating symptoms: frequent urination, weak stream, feeling like you can't fully empty your bladder, and those annoying nighttime bathroom trips. The research suggests that regular ejaculation helps maintain healthy prostate function by preventing the buildup of prostatic fluid and promoting better circulation to the area. It's like a natural maintenance system for one of your most important glands. Dr. Abraham Morgentaler, a urologist at Harvard Medical School, puts it perfectly. The prostate is designed to be used. Regular ejaculation is part of its natural function, regardless of age. The brain benefits, more than just physical, but the benefits go far beyond the physical. Sexual activity, including masturbation, triggers the release of powerful neurochemicals that become increasingly important as we age. During orgasm, your brain releases a cocktail of beneficial chemicals. Endorphins, natural painkillers; oxytocin, the bonding hormone; prolactin, which promotes relaxation; and dopamine, the pleasure chemical. For older men, these chemicals can help combat depression, reduce anxiety, improve sleep quality, and even help with pain management. There's also emerging research suggesting that regular sexual activity might help protect against cognitive decline. A study published in the Archives of Sexual Behavior found that older adults who maintained active sex lives scored better on cognitive tests and showed better memory function. The immune system boost. Here's something that might surprise you. Sexual activity actually boosts your immune system. Research from Wilts University found that people who had sex 1 to 2 times per week had 30% higher levels of immunoglobulin A, an antibody that helps fight off infections. For older men, whose immune systems naturally weaken with age, this boost can be particularly valuable. It's like getting a natural immune system upgrade without any side effects. Addressing the myths and fears. Let's tackle some of the specific fears that keep older men from embracing healthy sexuality. Myth 1. I'm too old for this. Truth. There's no expiration date on sexual health. Men in their 70s, 80s, and beyond can maintain healthy sexual lives. Myth 2. It's not normal at my age. Truth. Studies show that 40% of men over 65 masturbate regularly. You're not alone, and you're not abnormal. Myth 3. It will worsen my medical conditions. Truth. For most men, sexual activity is safe and beneficial, even with common age-related conditions like diabetes or heart disease. Always consult your doctor, but don't assume the worst. Myth 4. I should save my energy for other things. Truth. Sexual activity actually gives you energy by improving circulation, reducing stress, and promoting better sleep. The practical reality. What changes and what doesn't? Let's be honest about what changes with age. You might need more time for arousal. You might not have the same frequency of desire you had at 25. Recovery time between sexual activities increases. These are normal changes, not failures. The key is adjusting expectations and finding what works for your body now. Some men find that masturbation becomes more about stress relief and overall wellness than intense physical pleasure. Others discover that with less pressure to perform, they actually enjoy sexual experiences more. The doctor's perspective. When to seek help. As a urologist, I want to be clear about when you should seek medical attention. If you experience sudden changes in sexual function, pain during ejaculation, blood in semen, or a sexual activity causes chest pain or extreme shortness of breath, see a doctor immediately. But for most men, age-related changes in sexual function are manageable. There are medications, devices, and techniques that can help maintain sexual health well into advanced age. The bottom line. Your health, your choice. So is masturbation healthy for older men? The science is overwhelmingly clear. Not only is it healthy, it's beneficial. It supports prostate health, cardiovascular wellness, mental health, and immune function. It's a natural, safe, and effective way to maintain an important aspect of your overall health. The real tragedy isn't that men age and their bodies change. It's that shame and misinformation rob them of something that could genuinely improve their quality of life. You don't need anyone's permission to prioritize your health. You don't need to feel ashamed about maintaining your sexuality as you age. What you need is accurate information, and now you have it. Remember, sexual health is health, period. It's not vanity, it's not inappropriate, and it's not something you need to grow out of. It's a legitimate aspect of wellness that deserves the same attention as diet, exercise, and regular medical checkups. If you found this information valuable, make sure you're taking care of all aspects of your health. Talk to your doctor about your concerns, stay active, eat well, and don't let anyone convince you that getting older means giving up on feeling good. Your health is your responsibility, and now you have the science to make informed decisions about it. Stay healthy, stay informed, and remember, age is just a number, but health is a choice.